Hello, my name is Rebecca and I am part of the SD36 Healthy Kids Initiative organization. I will be talking to you today about childhood obesity among children from the ages 5 to 12. We are a not-for-profit organization and we seek to better understand the health of elementary school children through providing a pay-what-you-can healthy lunch alternative during school, as well as a free e-health program that educates parents on nutrition and helps parents to prevent unhealthy eating behaviors in their child. According to the World Health Organization, childhood obesity is a growing public health challenge. Globally, over 41 million children under 5 were overweight in 2016. There are currently 31.5 million children who are obese from the ages 5 to 19. Obesity is defined as a non-communicable disease, which is the result of excess body fat accumulation due to physical inactivity and poor diet. Obesity has become a population health issue within Canada. The Government of Canada found obesity rates have tripled over the last 30 years among youth and children within Canada. Within the Fraser region, 54% of youth do not eat the recommended daily servings of fruit and vegetables, and 49% of youth do not eat breakfast on school days. Our objectives are that within 2 years, the BMI of children participating in the intervention will have decreased and the children's healthy eating behaviors will have been improved. By the end of the program, knowledge about nutrition and healthy eating among parents and children will have increased, and children will have a greater positive attitude towards eating healthy and healthy foods. Our goal is to increase awareness and decrease the prevalence of childhood obesity among children in 15 lower-income elementary schools in the Surrey School District. We will accomplish this by implementing a pay-what-you-can lunch program for all students at each of the schools. The lunch program would be $100 per student for the entire year. For families unable to pay the full amount, some suggested payment options would be to pay the full cost for your first child and half for each additional child. However, if you are unable to contribute, your children are still welcome to register for the program. We will be applying to our municipal government under the Community Enhancement Grant, Neighborhood Grant, and Council Initiative Community Grant. This will be reviewed by the Community Enhancement Liaison. We will be asking for a combined $100,000 in funding from the government. We will also use Community Link, a program that provides funding to all 60 boards of education to support vulnerable students in academic achievement and social functioning. They will be reaching out to grocery stores for food donations that will be used towards the lunches. We will also be developing an online module for the parents that will address awareness, knowledge, behaviors, and attitudes towards childhood obesity, along with the distribution of weekly e-newsletters, which will include information about childhood obesity, create awareness among parents, and include healthy recipes. Our program will be running for the entire school year, adding up to 190 lunch meals, costing approximately $1.41 a meal. We will need to feed approximately 6,000 students. With increased funding and positive results, we will continue with the implementation of our program within the 15 schools and expand the program to all schools within the Surrey School District. We will do this through strengthening our already existing partnerships and branching out to new ones, as well as changing program objectives and goals according to evaluation findings. We will select a random sample of students from each elementary school to collect the BMI among these children before implementing the Healthy Lunch program. Then we will select a random sample of students after a year from each elementary school to collect BMIs again, which will help in achieving our first objective. We will also assess the number of lunch meals provided to elementary school children in 1 year to check how many children had healthy lunch meals. We will also send online surveys to parents to evaluate the program, assess the children's current eating behaviors, their thoughts on the program, and how improvements could be made to achieve our objectives on increasing knowledge among parents and children about healthy eating behaviors. We will also do a survey halfway through the year asking children their thoughts about the program overall. Thank you for listening.